Vamaka Dravya explained in Kalpasthana for Vamanath. The raw Jimutaka has been dried in sunlight. When the pulp of the fruit was collected fresh, it used to weigh around half kg, more than half a kg. But after drying, the weight of this fruit is around less than 50 grams. So 1/10 times Jaladhatu is dried up. And Vamaka Dravya has to be given in the form of dry, that too particularly this Jimutaka, because if we give in wet condition, that has Jala Pradhana, there will be Virechana effect. For Vamaka Dravya to act as Vamana, it should have Vayaviya and Akashiya Tattva. So Vayaviya because it is Laghu, Akashiya it is porous. You can see this is Phalamajja of Jimutaka with seeds having 3 lobules which are from this end to that end connected. So, bija are present inside this. This is the bija. So when bija is not available, we use Jimutaka Phalamajja. Phalamajja is Ati Tikshna. Usually it is used in Kamala Chikitsa, which is very commonly used in coastal areas like Kerala. In Karnataka, some doctors use, and in Hubli, possibly very few. That is, 3 of us in Hubli are practicing JIMUTAKA Nasya. So we are using Jimutaka Dravya for Nasya Artha, that too with Dugdha. Yad Dugdha Bhavitam Jimutaka. So this Jimutaka has to be Dugdha Bhavita for Nasya purpose. So we will take small amount of pulp of Jimutaka and prepare Nasya Dravya. So we have collected small amount here. And you can see the fibrous and small adhesions, very thin layer like dried saliva attached to this fibrous pulp of this Jimutaka. Now this Jimutaka we are triturating with Godugdha, and that same Jimutaka will be used, the triturated Jimutaka will be used for Nasya. So when you are preparing the medicine, it is to be in such a way that the medicine has to be chopped well to small pieces like this, so that the pulp gets released easily. The fibers are very strong, and at some areas this pulp after drying is used for bath as a scrubber. So they don't know the importance of Jimutaka. So we will put about, to reduce Tikshnata, Dugdha is used, because Dugdha is Madhurasa. And about 3 ml of Dugdha we are using to triturate this pulp. So the pulp has to be triturated well, soak it well in the Godugdha for a couple of minutes, and then prepare filter this and use it. In fact, for Koshtashakhashrita, complete Koshtashakhashrita Kamala, Jimutaka should be used with Matrusthanya. Matrusthanya is human milk. where after instilling Jimutaka Nasya and complete Koshtashakhashrita Kamala, that is when bilirubin levels are very much raised, in such condition, when Jimutaka Nasya is given, that will make the person dribble yellowish watery fluid discharge, that is the bile gets secreted from the nose dribbling, and that is considered as the bile which is going out. Now we have tried it in so many patients in our practice, and after the Jimutaka Nasya installation, when we have checked their bilirubin, it has drastically reduced. But the caution is, it is Ati Tikshna. Ati Tikshna is Ati Tikshna. So it should be done under proper guidance, and one must be thorough in managing the complications too. Today we are using this in Hepatitis B case, known case of Hepatitis B positive with high viral load. Let us see after installation. I will show how it is instilled in some time. Blood pressure and all are normal. We must start instilling 8 drops. 3, 4, 5, 6. So once the Jimutaka Nasya is instilled, unlike other Nasya, don't ask patient to breathe very fast with the nose. Allow the patient to breathe through orally. Why nose already? Orally, so that the Nasya Dravya goes slowly, and sometimes patient can get reflux due to trigger of the Jimutaka to throat, and they may get cough or sometimes vomiting also. But he is quite comfortable. He has been receiving it for last 3-4 episodes, so he is really comfortable in taking Jimutaka Nasya. So this is process of Jimutaka Nasya installation. Thank you.